Okay, we're going to talk about vaginal dryness, decreased libido, painful intercourse, and dryness of the skin. So when we have vaginal dryness, it often presents itself with an itchy vagina or burning in your vagina. You may start to develop increased urinary tract infections, or you may start noticing painful intercourse. So when this happens, it's also called vaginal atrophy. When vaginal atrophy happens, it's due to the lack of moisture. I mean, our vaginas and perineum area is the biggest orifice that are mucosal membranes. So we definitely feel that dryness. But when this happens, our muscles and ligaments are losing their tone, and it can cause more problems like uterine or bladder prolapse, which is when your uterus or your bladder start succumbing to gravity and pushing their way down into your vagina because your ligaments and muscles aren't toned enough to hold them up again like they used to. So if this happens, you definitely want to see your medical provider. Sometimes you can do Kegel exercises to help with the muscle tone. And that is if you're in midstream of urine, you're going to use your vaginal muscles to try to stop that urine in midstream. And if you're nice and toned, the urine will stop. And then when you release your muscles, it will go again. And then you could be able to stop it again if you tighten and release it. Those are Kegel exercises. But if you try to do that and your urine keeps coming, you've lost your vaginal tone, and it might be beneficial to talk to a practitioner so that it doesn't lead to further like prolapse or anything. And oftentimes when we have this vaginal atrophy and we can't do our Kegels, then that makes us more prone to urinary incontinence too. That's not fun. So definitely talk to a practitioner. And everything else that I talk about in this section, if it doesn't work for you, or it seems, too messy, or you don't want to deal with any of this, then you can also talk to your medical practitioner about getting on some bioidentical hormones, which can help keep and increase the muscle tone in your vagina and help with the dryness. And it obviously bioidentical hormones can rebalance your hormones, so it can maybe make all the menopause symptoms less severe. But that is your prerogative. What we're doing here is trying to deal with natural help. So what can you do? You can use lubrication, vaginal lubrication. So that can be found in a grocery store, in a drugstore, Target, Walmart, pretty much any place. When you choose one, you want to choose one that is more natural and that you can actually know what the ingredients are that is in it. And you definitely want to choose a water-based, water-soluble lubricant, because our bodies are made of like 65–70% water. So we want those to be absorbed. We want to stay away from petroleum or glycerin-based, because those just sit on the top, the outer parts of our tissue. And, our perineum area is warm, moist, and dark, and that is the breeding ground for bacterial infections. So you definitely don't want to use the petroleum or glycerin based, and you want to keep clean. And on that note too, a nice thing to be able to allow air and so your perineum can breathe is to wear cotton underwear rather than, nylon or synthetic type underwear, because it just doesn't allow you to breathe, your skin to breathe. But you can use those over-the-counter lubricants. You just want to also stay away from flavored or scented lubricants. And if you rather use something more natural, you might find it in your kitchen cabinet. It could be any of the oils that you use, and any of the healthy oils, which have lots of vitamins and minerals and nutrients and anti-inflammatories and fatty acids and amino acids and linoleic acids, lots of beneficial nutrients to help keep our vaginal tissues moist. So what you could use is organic coconut oil, organic extra virgin olive oil, jojoba oil, vitamin E, aloe vera. Some people like to use homemade, unflavored, unscented yogurt because it has the lactobacillus in it, which helps replenish our probiotics that are lacking in our vaginas. You can also eat foods with fatty acids in them, like the oily fishes, the salmon, sardines, mackerel. Some people say tuna, also flax seeds and sesame seeds. And pretty much what you're going to do when you're using these lubrications is you're going to use them 2 to 3 times a week. That is the recommended amount of time. When you use these lubrications, it's also recommended to stimulate your sexual arousal, because that is what helps your vaginal muscles contract. So if you don't have a partner, you can still do it by masturbating and using a vibrator. If you do have a partner, you're going to use these oils in your vagina and on your partner. And then if you're going to have, if you are going to have sex, you want to just maybe take it a little slower, but before you do, because of vaginal dryness, you want to increase the foreplay or oral sex or mutual masturbation or using a vibrator or massage or whatever helps get you stimulated, excited, and your body producing your natural secretions to make it so that the sex is less painful. They also suggest taking it slow with sex anyway, because our Bartholin glands in our vaginas are as old as we are, and they're a little bit slower in producing the secretions that they normally do once we have sexual arousal. So if you are having either painful intercourse or a decrease in libido, I mean, you want to just have good communication with your partner and let them know what's going on, and that it's not their fault, and just that you need their support. And then you can both work on maybe doing some of the suggestions I just mentioned, or coming up with some of your own to make that your bedroom and your closeness and intimacy to continue and still work for you. But if you are having painful intercourse, you definitely need to talk to your medical practitioner just to make sure it's nothing that is abnormal in your body makeup, and it just needs an exam and probably some testing. And just take it slow and stay away from penetration if it is painful, and do the other aforementioned suggestions that I gave you just a minute ago. If you have the decreased libido, where you're just not feeling it, and what I found in the research is that most everybody agrees that it's our menopause symptoms, the other symptoms that we're feeling, that contribute to this decreased libido. And hopefully, if we're doing the first 9 steps or suggestions that I've made at the beginning of this class, maybe we can alleviate some of our symptoms, and that can help increase your libido. But another general consensus in the research I've done is that there may be some possibly hidden or something that you aren't aware of, emotional trauma or incident that may have happened in your childhood or life up until now that is causing this decrease in desire. So, you know, if it's not too bad, maybe you can do some journaling and try to figure out exactly what it might be. But if it does end up through journaling or through thinking about what it might be, it becomes something that needs more help, definitely you need to get some, maybe see a psychologist or counselor or sex counselor, somebody who can help you with that. So I hope that these suggestions have hopefully helped a little bit or a lot, and that you can continue to experience pleasure and also stimulate that muscle tone, because remember, it's just as important as regular exercise, and it's probably more fun as long as you're not having pain, right? So we are going to talk about skin dryness. So our skin is our largest organ in our body. I was just looking for my dry skin brush, but I think I put it away. Our skin's our largest organ in our body, and so we need lots of moisture to keep it nice and moist. When it's dry, it can be flaky, itchy, and even painful sometimes. So we want to do what we can to make sure we stay hydrated, drink that recommended amount of water daily, and you can even eat well, fruits and vegetables like cucumbers and fruits, and watermelon are all very hydrating vegetables and fruits that you can eat that can help try to get you hydrated. But you can also try maybe eating some collagen-rich foods, or foods that help stimulate your body to produce collagen to keep your skin more toned and supple. So those would be citrus fruits, strawberries, guava, broccoli, spinach, kale, garlic, and bone broth. So those can all be stimulators to help your body build collagen. And other things you can do for your skin is the dry brushing. And dry brushing is with dry skin, and you use a dry skin brush that has bristles on it, but they're softer, but still firm enough to exfoliate your skin, which is what you're doing with the dry skin brush. You're going to use a firm amount of pressure, and you're going to start at your extremities. So I usually start with my feet and work my way up on one leg, make sure I get every single area of my skin on my calf and shin, and move up onto my thighs all the way around, and then into my buttocks, and up as high as I can go on my back. Again, moving up your body towards your core. And then I do the other side, same thing, feet, calves, shin, all the way around, thighs, up into the buttocks and back. Then I do my hands. I use the brush, bring it up all the way around towards my heart, get as far back as I can on my back, and do the other side, do my abdomen, and do my chest. The reason we go upwards is because it's helping our circulation, but we're also stimulating the lymphatic system to keep working to help pull out the toxins from our body so we can detoxify at the same time. It also exfoliates us so we can remove that first layer of dead skin, and it stimulates our skin to start making more of the new cells that are more full of moisture. So that is very beneficial, and it also can help stimulate your whole body. Another suggestion is to eliminate really hot showers. Of course, you can have a warm, tolerable shower, but you just don't want it to be scalding hot, because that can strip your body's ability to produce the natural oils that it's supposed to make. And they also suggest not showering every day. So maybe 2 or 3 times a week, because again, that strips your body from creating its natural oils. So also, after showering, you're going to use moisturizer, but that being said, I just want to mention and that there's so many bath, body, and beauty products that are full of toxins. They're being sold everywhere and made by everyone, but you really want to look for organic and natural cleansers, shampoos, conditioners, soaps, lotions, makeup, moisturizers, whatever you use, it should really be organic. Dr. Bonner's has organic soaps, and I like Anne-Marie Gianni. She's online. She has very organic, natural facial products. And Purity Woods is another online manufacturer too. But you kind of have to do your research, but it's really helpful to use organic, non-toxic, whatever, lotions, powder, lotions, soaps, because your body absorbs everything you put on it, and that goes right into your body. The Environmental Working Group is a nonprofit organization who does extensive testing on many of the products that are for sale that people buy, and they rate the toxicity of these products and the cleanliness of these products. So it's very helpful to check that out. And they also tell you about the Clean 13 and the Dirty Dozen, and those are the foods. The Clean 13 is what you need to eat that are organic, and then the Dirty Dozen are foods that you don't need to have organic foods. Anyway, that was my spiel on dry skin and vaginal dryness. I hope this helped. Thank you for listening.